Okay, my name is Fábio Correia Sampaio. I'm from Federal University of Paraíba, Brazil, and I'm sharing this presentation with Professor Marcelo Bonica from University of São Paulo, Brazil. We are both presenting consensus from caries about caries, and we call this presentation A Cavity-Free Future for Latin American and Caribbean Population, Recommendations from a Regional Dental Caries Consensus. I must stress that this chapter of ACFF includes not only Brazil, but also Mexico, Colombia, and Venezuela. And we are really delighted to be in the program for presenting this topic. Well, what's the driving force for this consensus was really a question. When dental caries was analyzed and evaluated in a regional perspective, and when I mean regional perspective, I mean Latin American and Caribbean countries. We have this LACC abbreviation to refer to this geographic area. So along the history and so many studies in epidemiological studies, we have never discussed caries in this regional perspective. So the idea was to develop a regional consensus, and it was worked through the last year. And I should present a little bit of our achievements. And I must also pinpoint that this material is already available. You can use this QR code to access the publications, the whole publications in the Brazilian Oral Research periodical. Well, we assume that dental caries is a preventable disease. All experts in the world assume that we have enough knowledge about the prevention and control of dental caries, particularly to avoid cavities. So it's very important, this ACFF Summit, to really reinforce that. And the recommendations for Latin American and Caribbean countries must be established considering this perspective that dental caries is preventable. We have enough techniques for assuming that, and we are not probably using it in the full perspective. So what is Latin American? Actually, it's a geographic area that comprises 33 countries and 15 autonomous territories, includes more than 600 million inhabitants, represents 9% of the world population, and we might reach 730 million inhabitants in 2050. That's quite amount of people living in this area. What many experts do not know is that there is a high urbanization rate in this area. In other words, we have many Latin Americans living in urban areas, in cities. And these cities are really packed, and we share similar problems. We have economical problems. We have overburdened public healthcare systems. Some countries do not have even a complete healthcare system organized. And we also share a really high level of social inequality. So how to control caries or cavities in countries that have so many problems? And we have also to understand that the moment we have the pandemic with the novel coronavirus here in Latin America, it was really a very strong process and difficult process. This figure shows the countries and the amount of people that were affected by coronavirus. And it follows the perspective of the population. Brazil, the most populated country in the area, also shows the highest number of cases, followed by Argentina, Colombia, Mexico, Peru. And considering the oral care service, taking this work that was performed in São Paulo as a representative of the area, we have observed that in LAC, in these LACC countries, dentistry drastically reduced their practice activity in half, which means that in public and also private sector were strongly affected by the coronavirus. And among the problems we already had for studying caries in this region, with the pandemic period, with the lockdowns and also the difficulties we have increased these inequalities. We have increased the social demands, and we are now facing even more problems with this situation, which justified the need of this consensus to share forces and efforts to reduce dental caries in this region. So what we built up was actually 4 chapters, taking account different perspectives. And we have the support from LAOHA, the Latin America Oral Health Association, that mobilized a local network of experts in cardiology, public health, epidemiology, pediatric dentistry, operative dentistry, and also numerous and several dental associations from the Latin American area and also international dental associations. A group of experts were divided and allocated with different of these chapters. So we explored dental caries epidemiology, risk factors for dental caries preventive strategies, and dental caries restorative management. After the preparation of these 4 reports, we had a final report with the more global perspective of showing these achievements and also providing some of recommendations that Marcelo will present afterwards. I must say that many of the associations reviewed or participated on the process of preparing this consensus, which gives us strong support from them, and it can say that there is a great representative participation of whole Latin America with so many associations, including the ACFF chapters in Latin America. So briefly, what we did was that in 2019, by the end of 2019, we had a period of planning, organizing the first idea of the drafts for the chapter. And in 2020, we started really the meetings with the experts, providing them the idea of preparing a report about the challenges for controlling dental caries in Latin America, and also discussing and providing a good brainstorm of how are the potential solutions we have at the moment. So we had a first revision with some of these other experts doing the revision. We had a presentation and a meeting, official meeting during the Brazilian IDR in September 2020. So the drafts were refined on that, the 4 chapters. And after that, we decided to start working with the final report, which is the paper 5 that provides the recommendations for that. So the first 4 papers presents the picture of caries in Latin America, the problem, the state of the art, the potential solutions. And in the final article, we present the final report with the recommendations. So to make a second run of evaluation, we had a meeting that was held in Mexico by virtual mode. Everything was by virtual mode. And after this meeting in Mexico, finally, we had a final revision that's refined the articles to have them finally printed and in 2021. So maybe a couple of months ago, it was available online. So we are glad to share this with you. So Article 1 provides us the idea that we have a lot of uncertainty. We have outdated epidemiological material. We need to synchronize epidemiological studies in Latin America in order to really tackle dental caries in a regional perspective. And most importantly, we have observed that dental caries in many countries are moderate to high, and give us the perspective that it's really challenging in this area. Article 2 presents us the risk factors, and I present here the idea that the social determinants are important for the outcome of dental caries. So this graph shows clearly with a comparison of the Gini index, which is the inequality index or social inequality index, compared to DMFT at 12 years old. We can block the countries from Latin America with the highest Gini index in one part. And we also can see that countries with a more stable economy and with more less problems according to social determinants, we can see that the Gini index is lower, and it's lower, and also the DMFT, a clear connection between the social determinants and dental caries in the Latin America region. The chapter 3 shows that fluoride it's still it's widespread in some areas, but we still have a lack of data about the legislation on the fluoride in dentifrice. Fluoride also, I'm not showing this map, but in salt and water fluoridation needs some vigilance studies, surveillance studies, and as well for fluoride dentifrice. So few countries explored the idea of following up the quality of the fluoride dentifrice that are sold in Latin America. So we need to increase this type of study in the region. Article 4 presents very elegant flow charts when we need to think and rethink the strategies when the cavity is already present. So these are the potential for us to provide some material for dentists, for dental associations, in how to control and avoid more cavities when they are already present in the oral mouth. So finally, we had the final paper, which is the Article 5, that included all the experts from the 4 previous chapters. And this cavity-free future for Latin America is a very important chapter for LAOHA and for us. And this is the first part of the presentation. I should leave that for Marcelo now, that will present some material about the recommendations that are presented in this chapter 5 paper. Thank you very much.
So hello, everybody. As Professor Fabio has said, I'm going to present now to you the summary of this regional caries consensus with the general and specific recommendations. As Professor Fabio said, we both invited many authors and co-authors for this paper, and I would like to highlight that Professor Nagelpitz also is one of the authors of this fifth article, final article, with the recommendations that I'm going to present to you right now. So to start with the general recommendations, I would like to highlight to you that one of them is that oral health should be considered as a human right. And this is a commitment that we have and ask for the public and for the government to create and implement economic and social policies to raise the living standards, according to what Professor Fabio has said to you, that the oral health conditions are very much related to the social and economic standards of each country and each region. Moreover, another general recommendation is to elaborate a positive agenda to develop guidelines for dental caries prevention and comprehensive management. And that's what we are going to show you that we have planned to do in the near future. Moreover, another general recommendation is to develop national systematic epidemiological surveys, because what we have seen in Latin America, that we have some epidemiological surveys, but sometimes they are not able to be compared one to another because they use different methodologies for this. And this creates a problem for us. Anyway, going along with the general recommendations, we still have the recommendation to investigate the interplay between various risk factors, because in Latin America, there are so many different ones, mainly the socioeconomic status, of course, but there are many other risk factors involved. And also, we have to investigate a low-cost therapeutic and restorative techniques to deal with the management of caries and to restore cavities and avoid new caries lesions in the future. Still among the general recommendations, and I believe these are very important ones, together with the government and food industries, we have to work in the reduction in the amount of sugar in processed and ultra-processed foods, and also together with the government, but now together with the healthcare industries, to work together to make effective anti-caries fluoridate toothpaste easily available, because this is one of the main ways to provide fluoride, topical fluoride, to the population in Latin America. But now, these are now the specific recommendations that we are going to show you, and you're going to see that most of them are related to reduction of sugar consumption and the use of fluoride toothpaste in this region. So the first specific recommendation is to limit sugar intake in foods and drinks in the region. Also, we have, as I told you, that we have to support the use of fluorides at the community level, and for example, salt fluoridation and water fluoridation, and also encourage the use of fluoride toothpaste also at the community level. But here we are not talking only about any kind of fluoride toothpaste, but anti-caries effective fluoride toothpaste, and which is very important because this consensus endorses the regular use of fluoride toothpaste as the main vehicle for topical fluoride. And also, we would like to improve the access of the whole population to a drinkable water, because drinkable water means that the water is treated, the water is good, and people have the right to have access to drinkable water. And this also could help people to prevent caries if the concentration of fluoride in this water is regular, and could help to improve oral health. Going on with the specific recommendations, as I told you, we are not only talking about any kind of fluoride toothpaste, but we have to guarantee the minimum amount of soluble fluoride in the toothpaste to guarantee an anti-caries effect for the whole population in Latin America. And moreover, we are not only talking about water fluoridation or salt fluoridation, but we also have to claim for a process to guarantee the optimal concentration of fluoride, both in water or salt, according to the decision of the country. And one of the final recommendations, specific recommendations we make, is that regarding the possibility to treat and to manage caries, dental caries lesions, we have to use silver diamine fluoride, and atraumatic restorative treatment should be considered as a good strategy for this population when we are talking about caries lesions management. And also, we have to provide good quality information to the public regarding these issues that we have just mentioned to you. And based on that, exactly on provide good quality information to the public, we decided in May this year, when we finished the whole consensus process that Professor Fabio showed you, the 5 articles were published in the beginning of this year. So in May this year, we decided to go along and start a new phase for this caries consensus in Latin America. So Professor Fabio and I decided to create a cardiology group in Latin America, and we invited for that many authors and co-authors of the articles that were presented before. And so we could launch and build up a group of experts that come from different parts of the region to develop some strategies in how to implement the evidence-based we got from the articles produced for the caries consensus. But now it's time to implement this evidence-based and collect information from the population and give back to the population some information to help them to increase their quality of oral health. So we decided that we are going to have this call for action, and this call for action is going to happen in October 2021, exactly on the 14th of October. And we know that the 14th of October is the World Cavity-Free Future Day, launched by the Alliance for Cavity-Free Future. So we decided to launch this action on the same day of the World Cavity-Free Future Day, because we have a plan to develop these actions during the next year. And we thought it would be very much appropriate to launch the actions on the same day that we celebrate World Cavity-Free Future Day. I must say that the Alliance Cavity-Free Future chapters in Latin America are supporting this initiative. And of course, we have Professor Nigel Pitts with us. He's going to give a lecture. I'm going to show you this in my next slide. But what I want to say here is that everybody all over the world is invited to participate to this action. It's going to be a free action, virtual action, and it's going to happen, as I said, on 14th of October 2021. The idea of the actions that we are going to develop in the next year are based on the general recommendations and specific recommendations I have just shown you. And mainly, they are the new actions that we are going to develop are based on reduction in the amount of sugar in processed and ultra-processed foods, and make effective anti-caries fluoridated toothpaste easily available for the whole population in Latin America. Moreover, because we believe that the dental students are future stakeholders and policymakers, this group decided now to tackle an action to include cardiology education in dental schools and guarantee that cardiology education is available in all dental schools in this region. Moreover, the idea of this action is to support the development of a core curriculum in cardiology, both in Spanish and Portuguese-speaking dental schools, okay? This is based on the recommendations we created in May 2021, but the action is going to be next week, actually, in 14th of October. And the agenda for this action is based on 4 lectures. Professor Nigel Pitts is going to be with us, giving a lecture about a cavity-free future for Latin America and Caribbean countries, making cavities history. And then 3 people from our group are going to explain the 3 actions we are going to have in the next year. Professor Saul Paiva will talk about the action 1, which is the situational diagnosis of Latin America and Caribbean policies on sugar consumption reduction and use of fluoride toothpaste. The action 2 is leading by Professor Stefania Martignon, and she will talk about a Latin America consensus of cardiology teaching for Spanish undergraduates. And the action 3 is coordinated by Professor Fabio Sampaio, who is going to talk about developing a consensus for teaching dental caries in Brazilian dental faculties. We invite you to come and join us for this action. And I would like to finalize this telling you that the aim of these 3 actions are to enhance the engagement of the stakeholders along with the policymakers, medical personnel, universities, dental associations, community members, and industries in order to orchestrate a regional plan to create a positive oral health agenda for Latin America and Caribbean region. And for that, if you want to know something more about the LAOHA, Latin America Oral Health Organization, here you have the link to open the website. And also, if you want to know a little bit more about the call for action that we are having on 14th of October, you are welcome to visit our website, laoha.org.br/cariology. And in both sites, you are going to find much more information about the past actions we had that Fabio has already described to you and what are the plans for the near future. Saying that, I would like to say thank you for all of you. And here you have our both contacts in case you want to get in touch with us. Thank you very much. Enjoy the Universal and International Cavity-Free Future Day today. Thank you.